Did you know that at least 50 to 60% of women in the UK will experience at least one UTI in their lifetime, and 1 in 5 women will experience recurring UTIs? This prevalence can increase during perimenopause and menopause as hormonal factors impact urinary health, and this doesn't go away after menopause. If anything, they can actually increase in postmenopause. So let's talk about this. So number 1, lower estrogen. Estrogen maintains the health of the vagina, the bladder, and the whole of the urinary tract. So if we have less estrogen, the vaginal walls and the bladder, they can become thinner, they can become less elastic, they can become much more sensitive and drier. Changes in bacteria levels. So we have a whole family of friendly bacteria in the vagina that also protect the bladder. When the vagina starts to change, and especially if you get vaginal dryness, this can impact on the friendly bacteria, leaving you much more vulnerable to infections in the bladder. Changes in the urethra. The urethra is the tube from the bladder to the outside world. Falling estrogen can impact on this. It can make it thinner, it can make it less elastic, it can make it much more sensitive. And when that happens, it's much easier for these bad bacteria to travel up to the bladder and then trigger a bout of cystitis or other bladder infections. It can be incomplete bladder emptying. So what can happen, especially post-menopause, you can get something which is called a prolapse. So the position of the bladder can change, and it means that it's much more difficult to empty the bladder. If your bladder is also more sensitive, it means you're running to the toilet more often, but very often you're not emptying your bladder completely, and the urine that's left just sits there, and that's a perfect breeding ground for those bad bacteria. It can be a weak immune system. We know that lower estrogen can make our immune system less efficient. Therefore, we can be more prone to any kind of infections at all. It can also be after sexual activity. We know that during sexual activity, you're going to be introducing lots of different bacteria into the vagina. And if all the other symptoms that I just mentioned are in place, it means that you're much more likely to end up with bladder infections. So how to prevent this? Really the basics, hygiene basics. So remember to wipe from front to back when you go to the toilet. Try and use unbleached or natural toilet paper, so you're not introducing chemicals that may affect what's left of your friendly bacteria. Hydrate yourself. Make sure that you're drinking plenty of water all the time to keep any bad bacteria flushed out of the bladder and the urethra. Try and empty the bladder properly. Now, we're in a rush, so we force ourselves to go to the toilet, and very often that will leave urine in the bladder. So allow the bladder to empty naturally, and just give yourself an extra few seconds on the toilet before you get up. Remember to wear cotton underwear so that the whole area can breathe and it's getting plenty of air. And remember, don't wear G-strings, because they can be really bad for transferring bacteria from the bowel into the vagina and then up into the bladder. Remember to empty your bladder, especially after sexual intercourse. Watch out for antibiotics, because if you take antibiotics for one bladder infection, that's going to affect the friendly bacteria in the vagina, which is going to make you more prone to more infections and so on. So one of the things you can take, especially after antibiotics, and if you're getting reoccurring infections, is to take what's called a vaginal probiotic. You can also take our uva ursi and echinacea remedy for cystitis. I hope this has helped you. It's so common, and I know how awful it is. One of the worst things that you can experience. It's so dreadfully uncomfortable, and anything you can do to prevent this from happening is going to be really beneficial. Have you had this a lot? What did you do to stop it? What did you find really helped you? Please share your stories. You know I love to hear all about them. Have a lovely week, and I'll see you soon.